Hi, my name is Bryan and today I will be discussing the topic of smoking during pregnancy and alters in gene expression. In my opinion, women should not smoke, not only during pregnancy, not only for their health, but also, most importantly, for their babies. And it is estimated that 14% of women in the United States smoke during their pregnancies. And the most common side effect of smoking during pregnancy is a low birth weight. Other consequences exist too, like prematurity, chances of a miscarriage, abnormalities with blood vessels, cleft lip and plate. The heart rate and breathing is impaired during sleep. Infant death can occur. Asthma and cancer can even be a likelihood as the child grows and develops. The more cigarettes the mother smokes, the greater she puts her child at risk for all these factors. The question is, how does smoking harm the fetus? Well, nicotine in tobacco constricts blood vessels, which starves the blood flow to the uterus and causes placenta to grow abnormally. In return, this reduces the nutrients the fetus receives and can cause a low birth weight when born. Nicotine also raises levels of carbon monoxide in both fetus and mother, and even passive smoking should be avoided. If a mother that does decide to smoke can quit at any time up to the third trimester. In doing so, she can reduce all these risk factors. And even when a baby is born by a smoking mother, the baby may seem healthy in all ways, but it's still possible that abnormalities can affect the child's development. And children that are born to smoking mothers are less reactive and attentive to sounds and display more muscle tension and persistent crying. It also has negative effects on brain development. Children will also have shorter attention spans and problems with overactivity and poor memories and higher levels of disruptive behavior. Another factor due to smoking during pregnancy is something called sudden infant death syndrome, also known as SIDS. This is an unexpected death of an infant, mostly occurring at night and under the age of 1, and this is the leading cause of infant death in industrialized nations, and it accounts for about 20% of infant deaths in the United States. SID victims show problems right in the beginning. Babies have high rates of prematurity and low birth weights. They also have low ABGAR scores, and an ABGAR score is a method of quickly and at the same time assessing the health of a newborn right after birth, and that was developed in 1952 for those who do not know what an ABGAR score is. Also, there's high rates of limp muscle tone and abnormal heart rates and respiratory issues, and most babies that are victims of SIDS have respiratory infections at that time. And evidence suggests that impaired brain functioning is a major contributor to SIDS, and that environmental factors are related to SIDS, and smoking during pregnancy can double the risk for a child becoming a victim of SIDS. And babies exposed to cigarette smoke have more respiratory infections as well. SIDS can be prevented by mothers just simply quitting smoking, and it is estimated that 30% of SIDS cases would be prevented if mothers would just stop smoking. And lastly, abnormal alters in gene expression. Some studies suggest that individuals who are homogeneous, for those who do not know, homozygous, and for those who need a refresher on what homozygous means, this is a person with alleles from both parents that are alike. And so people that are homozygous and have a chromosome 5 gene of DD that contain a special base pair that repeat are at a high risk for ADHD. And studies on animals and evidence suggests that one reason for this inconsistency, why this inconsistency exists, is that due to toxic exposure. And this can happen by parents smoking during pregnancy, and parents that are exposing the toxins to their child modify their gene activity. And a test was done on several hundred women and their 6-month-old babies, and the infant's blood was drawn, and the mothers were asked if they had smoked during pregnancy. And then there was a 5-year follow-up on that study, and it was found that DD genotypes was unrelated to ADHD symptoms, but it was found that children that had parents that had smoked, at least a mother that had smoked, they had higher traits of ADHD. than a non-smoking mother. And but 5-year-olds with both parents that smoked yielded even higher rates than a single parent that smoked. But the DDD genotype is widespread and present in almost about 50% of individuals. So all in all, this means that children that are prematurely exposed to nicotine are at high risk for behavior and learning problems. Thank you for listening.